So welcome everyone. I'm Adelina Comas-Herrera from the Global Observatory of Long-Term Care, and I'm delighted to welcome you to today's webinar. I'm going to start by giving a very brief introduction of what the Observatory is and also let you know about our next event, and then we're going to hear from today's speakers. So the Global Observatory of Long-Term Care is a platform for cross-national learning to improve and strengthen care systems as part of the International Long-Term Care Policy Network. And it's basically here to discuss shared challenges in long-term care, showcase what we're learning in different countries, and also learning from the evidence of practice and of research projects. And it's open to everyone. We basically function through people being willing to share their work, like in today's webinar you're going to learn. But we are also very happy to publish blogs, methods, and topic guides. So do let us know if you have new research, new work that you want to showcase. And we also have country profiles. And we're building a growing database of lots of videos from previous webinars as well as publications. And we do now have quite a lot of interest groups, and you will see now what a range of webinars we have. So today we're going to hear from the GOLTC Migration, Mobility and Care Workers Interest Group, and we're going to hear of what makes a home-based care professional, looking at skills regimes and learning from Hungary. And just so you know, the next webinar after that, next week, is going to be the very different issue looking at orofacial pain, so the pain around the face and the mouth in nursing home residents. That's from the Pain in Care Homes Interest Group. We'll then look at perinatal mental health with case studies from Pakistan, Turkey, Ghana, Zimbabwe, and Gambia. So we're really going around the world. The week after that, we're going to have one in Spanish. So that one is, if you are learning Spanish, you're welcome to join, looking at reforms of the laws of disability and dependency. The week after that, the day after that, we'll be looking at private versus shared rooms in nursing homes, looking at some evidence from the US using post-experimental methods. And then we'll have one on innovation in long-term care, looking at design principles for cross-boundary collaboration in long-term care. So as you can see, a wide range of topics and a lot to look forward in the next few months. But now I'm delighted to hand over to Eva, who's going to introduce today's webinar. All yours, Eva.
Thank you so much, Adelina, and it's really impressing the variety of topics and spaces geographically seen. So I'm really impressed by your work. Thank you very much for inviting us, for hosting us, for this opportunity to present one of our team's work of CAREOC project. CAREOC project has started in 2023, and it investigates transnational senior care work from and within Central and Eastern Europe. So we are an international and interdisciplinary research team of experts in the fields of labor, mobility, care, and aging studies. And we are based in Hungary, like Dora Gabriel, who will share with us her research today, but also in Ukraine, Poland, Czech Republic, Romania, Netherlands, and Germany. So our main idea is to develop concepts to understand emerging transnational care markets and to identify solutions for sustainable and decent care work in Europe. CAREOC foregrounds the meso-level of transnational organization of senior care in Europe, and it includes topics like intermediary agencies, informal and formal platforms and social media, as well as transnationally shared infrastructure. Through our empirical and engaged research, we are going to map and analyze current and future patterns of commodifications, marketization, transnationalization, professionalization, the topic we will talk about today, and digitalization in the senior care sector. In doing so, the project focuses on sending region, with particular attention on Central and Eastern Europe. CARE uses a mix of methods, including comparative policy analysis and 5 country-specific and topic-oriented in-depth case studies. As I mentioned, we are committed to participatory research. Currently we organize local workshops to exchange information for policy interventions and knowledge co-production on local, regional, national, and EU level. We have finished a podcast series titled "Precarious," which you can find on this platform too, if you are interested. And we are just making 3 documentary films, which are taking place in Ukraine, Hungary, and Austria, where we managed to mobilize our key participants, like co-workers, the older people, NGOs, local communities, and to enable their active part in the production of knowledge. I think it's enough from or about CARE project, and I would like to introduce Dora Gabriel, my colleague. Dr. Dora Gabriel is principal investigator of the study in the CARE Hungarian team. She's a research fellow at the Center for Economic and Regional Studies at the Institute for Regional Studies in Budapest. She holds a PhD in sociology from the University of Pécs from 2021. Her fields of interest are transnational care, marketization of care, international retirement, migration, and the community shift in care provision. She's a member of the Eurocare Research Network and the Karl Polanyi Research Center for Global Social Studies. Her publications include over 20 book chapters and journal articles published in English and Hungarian. Her first book, Migrant Care Work in the Life Course of Rural Women, was published in 2022. And just to mention the latest publication in Economy and Society, it was published 2026. She was co-authored with Katona, and the title is The Quiet Collapse, Authoritarian Neoliberalism and the Crisis of Care of Older People in Hungary. Yes. It's a pleasure to have you here, Dora. The floor is yours now, and we can start. We have just 20 minutes, something like that, and after that we want to discuss your presentation.
Yeah, thank you, Adelina and Eva, for the introduction and for the invitation as well. So I would share my presentation and start it. I hope. So please let me know if it's in a good mode and you can see it.
Perfect.
Okay, so I slightly changed the title of my presentation only because this is the title of our upcoming article. I will put some articles at the end of the presentation. And also I put the name of my colleague here, Noemi Katona, who is my co-author, and I thought that it's important to mention her because we conducted this research together. Okay, I try to stop. Yeah. As Eva mentioned, that we are working within the CARE project that started 3 years ago, and we are finishing this project this year. Eva Palanga-Möllenbeck is the principal investigator of the whole project. In the Hungarian team, we are just 2 postdoc researchers, and actually we started to work on care and care marketization a few years before with Noemi Katona. At the beginning, we understood that in Hungary we will find a very big topic of informal care, and our focus was originally the informal care market and the care landscape in Hungary, because so far or before this project, nobody really wrote about that. Also, we were interested in the operation of different intermediaries, the training companies, matchmaking companies, and the professionalization of care workers. So somehow we try to understand how the market is working, but this market is different than other European countries' care market, because in Hungary there are no big corporates. Somehow these are smaller scales that we are talking about. And as Eva mentioned, we also had a research interest. This time I won't present about that, but maybe if you are interested, I can tell a few ideas after this. This sub-project is on communitization of care, because we understood that community is getting more and more important even in Hungary. So at the beginning of the research, we gathered the information on commodification and marketization of care. There were many very good articles and very useful ones which we could build on, which was the starting point. After and very soon, when we started the empirical data collection, we understood that it's a very big question, even in the professionalization of care, that how do actors define it? Like care can be understood as a recognized profession, which can be acquired through qualification and certificates can prove that, or care can be understood also as a natural feminine attribute, so like an innate ability of women. And this was one of our point that we had to observe. And as I mentioned, the informality was also very important, because we knew it from other colleagues' articles that formalization does not necessarily lead to better working conditions, but on the contrary, that even it can enhance the precarious working conditions. We found a very important author, Portas, who wrote about informality even in the early 80s. And he wrote about the role of the state in organizing and regulating production and shaping formal and informal economies. And that was an idea that we developed through our research. But in this paper, we focused on the skills regime, or at least we started to read about that first. It was a very useful paper from Jasmine Ortega and her colleagues. She defines skills regime as a loose configuration of policies, programs, and institutions that govern what constitutes appropriate skills for elderly care and who can be suitably equipped to perform such tasks. So according to this understanding, we had to consider all the care regimes, different care policies, these institutions that we have in the country where we conducted the research, or what we don't have. And this was one point. Also, Polanyi's concept, the tacit knowledge, which is actually very close to the silent knowledge, or almost interchangeable. So tacit knowledge means subjective embodied knowledge that cannot be fully articulated verbally. So this is different from professional knowledge that we can read in books, for example. And another very interesting paper was for us from Hussein and Kispeter, who tried to separate professionalization and personalization, because maybe we are aware of the idea of professionalization, which is based in qualification and certificates connected to education, for example, so the expertise of carers. But personalization is a bit different, because it focuses on the co-production between the care practitioners and care receivers. And very importantly, it focuses on the empowerment of care receivers. I would like to mention a few contextual facts about Hungary, because maybe you who are listening to this presentation haven't been conducting research on Hungarian care regime, which is very normal. So Hungary is a small Eastern European country where care for older people can be characterized as familialism by default or unsupported familialism, which means that the state gives some support to families or people in need, older people, but it's a very low level. So if you have the highest level of needs, you get less than 300 euros per month, and the family member who received this actually cannot work full time, which is not enough for making a living. So it's very problematic. It's a very low level of care allowance. But if we contrast the support, like state support for older people to the child care, it's very unproportional because families and children are priority, or at least it was priority for the previous government. But we have to see that there has been a big change in the last 2 months because now there is a new government and probably we will see some difference in social policy as well. As our other colleagues wrote about that, in many Eastern European countries, there is no coherent long-term care system, or the care regime is not so, let's say, developed for older people. And the whole infrastructure is struggling, or it's not really updated. So that's what we can see in Hungary as well, that the social care sector is the lowest paid field, the workforce is aging, and there are less and less new people who are entering this labor sector. And knowing the demographic tendencies, it's a very, very big problem. The other point is that it's about care homes and residential care homes, that actually the needs are rising, but the state just cannot guarantee the these needs, like they cannot solve it. And on the other hand, there are no data on the waiting lists right now, and we can see that like tens of thousands of people are on the waiting list, and many people just die before getting into a care home, so like they won't have any opportunity to stay there and spend the last years or days of their lives there, which is a problem. And yeah, and yeah, the political environment has changed in the last few months, which is probably it will have effect on the care regime as well. But before that, and still actually, because these regimes cannot change very fast, the home-based care market was very strongly under-regulated. So like kind of any care workers could work in the informal market, in the black market, let's say. The other aspect of this, that of course people or families in the upper middle class could afford to buy these kind of care services for their close relatives, but it created a huge division within society, because it's just a small part of society who could afford that, or at least other people maybe also bought this kind of service, but the quality was rather different from that. The other interesting point is that in the public and political discourse, care for older people is almost entirely missing. So politicians didn't talk about this issue at all in the last 16 years, so during the Orban regime. And if politicians don't talk about that, you can imagine that the citizens didn't really have the words or the causes, this platform, how to express their feelings about that. So this was a problem. It will change probably in the coming years as well. And also I would mention that Hungary is part of the transnational care market. There is also in and out migration of carers, but the majority are going to other countries like Austria, Germany, and the UK. So for this paper, we had 3 research questions. The first was about skills and knowledge that were constructed in the narratives of care workers, family members, and intermediaries when talking about good care. The second was what kind of qualifications matter and how much. And the third one was what skills does market-based training aim to develop and how far do these contribute to the professionalization of care services. So we conducted semi-structured interviews online, but mostly in person in Budapest with intermediaries and training companies, care workers, and family members. And also we conducted 2 small ethnographic research at training companies. One was an in-person training, and this company had matchmaking activities as well. And the second one was an online course. I don't want to talk too much about the ethical aspect of the research, but we provided anonymity to all of our interviewees. There was a consent form, and we found it very important from the beginning of the research. However, there are some limitations, like this research, like especially the ethnographic part of it is not representative because we selected these companies through the internet in a kind of random way. So only we found these ones who were willing to understand that this is part of a research. So they agreed that we can write about that and publish an article about our experiences. My first point is about personalization versus professionalization in the Hungarian home-based care market. We found interesting that there were many arguments for formal qualification contrasted to family care experiences, because obviously many care workers had experiences from home. Like I would just read quickly these citations from a care worker. She said that the problem here is that experience is not necessarily good experience. The way you do it might not actually be right. And the training company, like the representative of the company, said very similar things. It's not certain that someone who has cared for their own mother is suitable to be a professional caregiver. Through our training, we aim to ensure that caregivers can perform their job safely and competently. The other point was that many care workers refer to psychological skills associated with care and empathy and these soft skills. Like one of them said, you need to have a very good understanding of people, you need to know very well how to handle psychological cases or mental health problems. Even though they didn't learn this at school or they don't have a qualification in psychology. And the other one says this cannot be learned. It simply cannot be learned. A person is either born with it or not. So it's again the argument for care as an innate ability of women. The third point is the personal compatibility, because we found that for carers it was important that they can be more satisfied if they are able to choose their workplace or whom they care for. And it arrived many times. One of them says it also matters what kind of home you enter. The second point is the actually perception of companies and also families in a segmented market. Because the leaders of companies and also social media administrators who are connected to these companies and also to many care workers understood that the professional standards are kind of low. It means that care workers are not only not qualified, but they have sometimes just no idea about very basic things, what to do with a person in need. This first citation mentioned some of the problems, like there were cases and more than one involving incorrect medication practices, alcoholism, taking sedatives, not showing up for work, and abandoning the patient. So without protocol, without regulation, these kind of things happen very often. And it's really like a very hazardous what kind of care worker or carer you can get for your older mother or grandmother under these circumstances. Even somebody mentioned illiteracy, which means that these care workers were so uneducated that it caused them problems to put down words. So inadequate knowledge and skills were even among formerly qualified carers was a problem. But also, even if they had official certificates or qualification, it didn't mean that they are really experts in care work. And one of the matchmaking companies said that the CV is unnecessary. In most cases, there is no professional background behind it. And that was the idea, maybe when we understood that, okay, we have to go to a training to see if it's true or not, or like what kind of knowledge can training company offer. The other point that families didn't really care about the qualification of care workers. So it kind of never came up that a family member would ask for a document or the certificate of the care worker, but they were just interested in the the soft skills, the sympathy, the appearance of the care worker. And I think this citation shows it very well, what a family member can imagine about a care worker. This family member says that she, the carer, became absolutely dear to our hearts. She kept praying constantly for my mother-in-law. She could have listened to the radio, watched the TV, read the newspaper, done anything, but instead she chose to sit there and pray. This is really not connected to any kind of professionalization. And now, just very briefly, I would sum up what we saw at the trainings. I completed the on-site training, and my colleague Noemi Katona went to the online training. So the on-site training took 5 days in Budapest with 10 participants. It's a well-known, not well-known, but kind of recognized company with a higher prestige. There were different trainers every day, like pastoral carer, nurse, paramedic, marketing expert, and even a Catholic priest. And the whole material tried to focus on the everyday tasks of carers and the everyday issues that can emerge in such a situation. So they try to give a practical knowledge such as first aid or recognizing and treating or handling diseases, which was the main part of this training. But very importantly, it was interactive. So we could ask from the trainer, we could talk with other participants. So I was the only one who didn't want to be a caregiver, and I also told them at the beginning, but they had maybe more relevant questions and very practical questions, so we could discuss these things with each other. At the end, there was an exam, but was very useful for the care workers who participated, that there were already job opportunities from the company during this 1 week. So the company did this matchmaking for free, actually, and it was one of their missions. They didn't ask for money for this matchmaking, but somehow it went very well, because if you finish this training, you could get like very fast a job. At the same time, the online training was it was a very different experience. On the certificate, and also when they advertised this training, it was written that it's 220-hour long training. But in reality, my colleague finished it in a few days, so it wasn't really true. There were no real-time sessions or lecturers or experts, and she couldn't ask questions because there was no lecturer at all. The very interesting thing is that the training material was kind of inconsistent. So, like on one part, the language was highly medicalized, and even like a average person with a diploma or any kind of degree couldn't understand this language because it's a medical language. But on the other hand, there were also kind of description how to make coffee for the other person, like which is not really connected to care. And there were also totally irrelevant topics and questions at the exam, and also mistakes. So it wasn't really a serious training material. So I would like to wrap up this because I think I'm running out of time. So we have to see really the context, which is very specific. So without a political and a public discourse on care for older people, without regulation, and without protocols for the care workers or family members or even the carers, it's a very different situation and very difficult to enforce some interest or like how to do it well, because this is like a very underfunded sector in Hungary, and the state support is so limited that the families started to find their own way. And one of these way is the social media, which became a dominant sphere for connecting care workers with the households. But it led to the lack of quality assurance and the capacity to establish professional standards. And we can see this result. And the personalization of care services was very highlighted or like very emphasized in our research as well. But also we saw that intermediaries and qualified carers provided a more nuanced understanding of the patient's needs. Family members didn't really reflect on these specificities, but also carers without training either. So like we can see different levels of engagement of care workers. The soft skills and the tacit knowledge were seen as more important, as we could see in the literature as well. And it reflects the weak institutionalization of care work and the understanding of care as women's natural or innate disposition rather than a skilled profession. So what I can suggest maybe to the new Ministry of Social Affairs to regulate this market and somehow regulate the professional standards with very strict protocols, because without that we would see this type of consequences. I put here some of our latest articles, and the next one is coming maybe in a few weeks or months. And thank you for your attention.
Thank you so much, Dora, for this very informative lecture. And we have 25 minutes to discuss what we heard. And I would like to open the floor for your questions, discussion. I will also look into the chat, but would suggest to, yes, just this hand. I see Anka, Monica, I don't see the, yes. We cannot hear you.
Can you hear me now?
Anka, yes, now we can hear you.
Thank you very much for the presentations and for all the information shared. Very nice project. Two questions. If there are any training companies offering formal qualifications for care workers wanting to work abroad, and if you could see any difference between the trainings that they offer and other training companies. And the second one is related to maybe differentiation of the needs that the families have for in caring their family members, because it's very different to care for people with uh, Alzheimer or other dementia problems, and it's really a matter of the types of the needs that the family members, the older people, have. So I'm wanted to ask you about all this, and thank you very much for sharing information on this very interesting project.
Shall I answer now, or?
Yes, I think it's a good idea.
Yeah, okay. So thank you, Anka, for your questions. For your first question, if there are trainings for those who work abroad, actually, yes. So it's very often that these people won't work in Hungary at all after completing this training. So the one that I completed, actually, I think it was in quality, it was a rather a good, but very short, but kind of good training. And even from this group, somebody was considering to go abroad. But I know that from other trainings as well. So the problem is that it's a kind of a waste of human labor force that everybody is leaving after completing these trainings. And if, for example, in Austria, which is the closest country to Hungary, and there is a very huge demand for care workers, it's required to have some kind of training, or at least, according to my understanding, it's very important for them. So it's very easy that they complete the training in Hungary and they leave. Of course, they need the language knowledge as well, but some of these women, especially from poorer regions, they just catch up there when they arrive to Austria and Germany. So there are very many diverse life paths. But I also understand that it's a different type of group, because the borders opened in 2011, so many Hungarian care workers and also other workers went to Austria and Germany after this year. So many people already left, and those who are still in Hungary, they just, because of family reasons or other reasons, they just want to stay. And maybe in a way it's convenient for them, even if they earn a bit less money. Your other question was about the different care needs. So yeah, I didn't mention that because I try to focus on the informal care market, that the social care is also an existing thing in Hungary. So the municipalities provide care assistance for people who are in need, but in a very limited hours. So like every day it can be just 1 hour maximum. And somebody, a social worker, would come to your place, and for just a very little amount of money, maybe they buy, like do the shopping or buy you medicine or something like that, which is, I think, it's a very good system. But on the other hand, there are families who combine the market-based services and also social services and also family care. So it was very interesting, or also kind of sad, that we saw that in families there are maybe 4 or 5 different caregivers for one person, because somebody is coming every week from the municipality as a social worker, somebody is an informal carer, which is a market-based service, but also maybe the neighbor is coming, or the grandchildren. So like it's kind of a mosaic. It's probably not very good for the care receiver, because it's difficult at this age to get used to so many different persons and schedules, but this is the way that families try to organize care. And the other point is social media. So it can be criticized as well because many families get their informal care worker from the Facebook groups, and you don't know anything about them. So maybe you can see a profile picture, maybe a reference or something which is not very official. So it's kind of risky, in my opinion. And we heard these kind of stories as well that it's sometimes it's not a good match, and the just bringing this social class into the discussion. We also observed that in circles, for example, in the better parts of Budapest, for example, like where rich people live, they give the contact of good care workers to each other. So like there is already a bubble, and these caregivers probably get a bit higher salaries. They have very good working conditions. They get free time as well, and it's just better for them and better for the families as well. But this is just a thin layer of society, and it increases the inequalities.
Thank you, Dora. Are there any other questions? Adelina?
Yeah, so I was very interested in the comparison of the training, and I just wondered if you wanted to say a bit more about what would be sort of a policy recommendation in terms of how to support training, but also access to training for people.
Yeah, so as for the training, so there is a state-based training which takes 2 years. This is the most serious one, I think, but many people don't have this much time. So they just want to start working. And in my opinion, everybody would need this longer training if they want to work in this field. But it's true that many like carers, but they are more of social workers or carers in institutions, complete this training. But they are not young people, but they already work at care institutions. And when we went to care institute, like residential homes, we understood that the new employees who are coming, maybe they don't have any kind of qualification because they just want to find a job and it's easy to get in, but they have to start this state-based training. So, and it's financed by the care institution. So it's very interesting that for 2 years they don't have any qualification, but they are doing it. So probably they are capable of that. But somehow this training is not for the college students or like people who are after high school. And but in the informal market, this is really messy. So that's why it's very difficult to categorize them and see what's happening. We try to do the mapping online, and we had these Excel tables and collect informations on how much it costs, how long it takes, where is it located, and who are the organizers of trainings. And we didn't really find it useful in a way that, okay, it's just a website, maybe websites that are fake, so we couldn't really decide if it's a real, true website or not. But we couldn't really analyze it because we were not sure if it's a true information or not. But if you ask about policy recommendations, like it would be very important to regulate this kind of activity, like what kind of company can offer this service, because it can be very dangerous for care receivers, actually. And I just tell you an example that my colleague who went to this online training had one information, or even it was in the exam, that what would you do with the care receiver if she is bitten by a snake? But in Hungary, we don't really have snakes, like we are not in Australia or wherever, but we have different kind of risks and accidents or more realistic problems. So it's not a relevant question, in my opinion. And maybe there were other questions which were not covered in the training material. So it's really just a paper, like a document, and you can show it to the families who are not interested in it at all. But I think also education would be important for the family members, because they have no idea what to ask when they are in this situation. It's very new for them. I guess it's very similar to in other countries as well, but I know that in the UK and in many other countries there are protocols, and maybe this topic is even more covered. So for example, right now I'm in Vienna, and in Austria I can see many advertisements about older people. If you need care, what phone number you should call, and this information is on the street. So this education of citizens would be a very important idea.
Anyone else? Any further questions? I don't see. So maybe I could follow up to the last point, and I think it's so surprising, your result, that there is no interest in professional care on the side of families, actually, who are naturally should be interested in it, and this point you raised on personalization, not professionalization, but personalization is important. So could you elaborate a bit more on this point? How do you explain it? Is it about money? Is it about certain concepts of care about home care, which evolve here? It's really very interesting and surprising, I would say. It's something, yes, emerging in the field, and it's not so obvious. Yes?
Yeah, from the perspective of family members, you mean?
Yes, yes.
Mhm. Yes, of course, for families, it's very shocking when they realize that how much money they have to spend for the other relatives. But it's not only about money, as I understand, but maybe so this informality is a whole thing in post-socialist countries. So I think it's deeply rooted in history as well. And okay, so I don't want to be essentialist or something, but we read about this, and especially from Portes and Joseph Barrett, and I think it was very revealing for us that there is some habit in certain countries where they try to solve these questions informally first. But also, if there was a formal institution which helps to people in this situation, it would be totally different. But it's not like that, because Hungarian families just, there is a bad feeling about putting the grandma to the care home. So first they try to find another solution. And if somebody enters your home, it should be a person you trust, and that's why this trust and this the empathy and how to say, when you find somebody reliable, it's more important. So we found this personalization in a way that, okay, the first impression should be good, and this is the starting point. And after yeah, they change the care worker. Kind of, there are families which change very often. Somebody told that, yeah, it was too late, but at the end they managed to get rid of the care worker. But also the problem is that sometimes the other person in need cannot really express their own needs. So the decision is based only on the family member who doesn't live there. So maybe visits just once a week or a few times a week. And yeah, so older people are not always listened as much as it should be good for them. And yeah, when it comes to the budget for that, so many people have very low salaries. So actually, half or even the majority of the budget or the payment for the care worker is covered by the family members. So like there is always a care organizer, and it's not the person in need, obviously. So somehow this professional background becomes the second aspect, or it will be revealed during the care work. So it can be a very good surprise as well, and it can be a very bad as well. But also the care workers are struggling as well, because it's not very convenient for them all the time. So it also happens that the older person has issues, or especially with dementia, he or she can be dangerous, or the care worker doesn't feel safe. So sometimes we heard the story that the care worker didn't have a room, or she had to sleep with a dog, like very bad stories. And it's difficult to have to express your interests, and to get better condition, like working conditions and living conditions, if there is no trade union, or you don't belong to a lobby group. And if you are an informal carer, it's very difficult. If you work at a care institution, it's you have the opportunity, and I think there is a big advancement or big progress in Hungary in this sphere. But out of institutions, it's a bit difficult.
Thank you. I don't see anybody.
And I'd like to just say that this was absolutely fascinating, and we're very keen to also hear from the other countries in the care.org project. So this is just an invitation to tell us more, and then we also to able to see this in context. And I think what is also really very fascinating is this relationship between the care provision in the country and then the kind of people who go to other countries to work, and the very different conditions that they experience. I don't know if you want to add with a comment, maybe both of you, Dora and Eva, on this comparative aspect of the project, and then get us wanting more for another webinar, hopefully.
Yes, I think that yes, time is running out, but one of the key results in Hungarian team, which is really very interesting, because we had a very similar methodological design and topic in Polish-German, Ukrainian-Polish-German case. The question about professionalization of education, which seems to have this opposite direction in Hungary. Yes, it's one of your key results, Dora, that there is this deprofessionalization going on, which, when I understand it rightly, is related to platformization of work. Yes, definitely.
Yeah, we don't call it platformization, or at least I understand that Facebook groups are not the platforms that you think, I think.
Yes, but shifting into, yes, this direct brokers like platforms and social media, which, yes, it's a kind of, yes, development we also see, but we, indeed, in our case, this professionalization is going on. It doesn't imply decent working conditions. So increasing professionalization can and does, as you said, imply undecent working conditions and precarities, new precarities. It's the same result, but this was so surprising for me that you what you stated at the beginning and in your research, that you see this development of deprofessionalization also in educational sector. Yes. And also some other differences between our case studies, like, yes, this educational market is, yes, it's a bigger one in Hungary, as I remember correctly. It's in our case, there are only intermediaries who specialize in education, so it's a part of their business. And in Hungary, it was a bigger picture, yes, and it was also independent on intermediaries, so it was interesting. And many of them were not for free, as I remember correctly, yes, it was also interesting. So this access to education was so unequal in these countries, in Poland and in Hungary, for care workers.
Yeah, and what I find interesting that is a change of political regime, because we are finishing this research this year when we documented what happened in the last years and decades. And it will be interesting to see the coming changes, because it has to be changed. And I think after this project, we will have some references to, tell our ideas to policymakers. So this is the biggest, maybe one of the biggest results of our 4-year-long project, that we can be part of something like a kind of a change with the help of our results, because the problem is that in Hungary, not so many people conduct research on care for older people, and we have a very small team, but we really try to focus on these general problems. And we hope that in the coming months or years, we can be in contact with people who will be interested in our ideas, maybe, or other colleagues' ideas. So it would be a big achievement.
So it's also our, coming back to your question, it's also our result that the education is very much fragmented. It's very much needed for care workers, and but it's underfunded, or it's not funded. It's only privately funded by these private actors, and it really needs regulation and standardization. There's no standardization. That is why it's not attractive for care workers to know. So there's a lot of work to be done in the sphere, I would say, Dora, yes?
Yeah.
And yes, and in these terms, very concrete recommendations for policymakers in these respective countries to regulate and introduce standards to this field.
Thank you very much. And with that, we reach the end of the time. That was a fascinating project. Thank you so much for sharing this carefully thought findings and many lessons, I think, that are very important for other countries as well. So we look forward to hearing more about this project in the future. And please let us know when you have more publications, because we're always very happy to share those. Thank you very much, and see you all soon.
Thank you, everybody who came to this webinar. Thank you, Adelina and Nas, for hosting us and organizing it. And yes, reach out to us if you're interested in the results. Dora has shared the link to our project homepage. You'll find the contact there.